Okay, doctor, let's just do the next letter evaluation for you. This is fine. It's okay. This is okay. This date should have been written over here like this. Dear Dr. Star, that's okay. It's not Mr. Smith. I hope you remember the basic lecture. Whenever the age is less than 16, you will write the full name like this without Mr. James Smith. Okay, because this is a young patient. It's like you know. So whenever the age is less than 16, you will write James Smith without Mr. They should know Mr. And when the age is more than 16, then definitely you have to write Mr. I'm writing ref for Mr. No, see, I told you in the previous letter as well that it should be written in the smaller letters. Not Mr. Smith again, you have to write James because the age is less than 16. Okay? Who was having signs and symptoms see, this is something I told you that it's wrong. Okay? And suggestive of it. It's not who was having signs. You have to write who has treated for. Okay, treated for recurrent respiratory tract infections. And again, please, it's smaller letters. That's why I said that you have made the similar mistakes. Okay, you have to avoid repetitive mistakes. Okay, it's okay to make mistakes, but try to avoid the mistakes that you have made last time and they are already corrected. Then you will learn on daily basis and you will improve. If you'll keep on making similar mistakes over and over again, then there's a problem. Okay. So your further assessment and management, including a double lung transplant suitability, would be appreciated. Double lung transplant suitability. Okay, because the patient has cystic fibrosis, therefore the patient has the patient is there for the respiratory tract infections due to the cystic fibrosis, right? So you have to mention that. Okay, so it should have been written, I'm writing to refer James, who has treated for recurrent respiratory tract infections due to cystic fibrosis. For the assessment and management, including a double lung transplant suitability, would be appreciated. That's the purpose. On this date, Mr. James, not Mr. James again, James, this should be smaller, with symptoms. See, don't make these styles. Okay, it's like similar. So, severe shortness of breath, this should be small, along with cough, fever, headache, facial pain, blood in cough. Also severe from, I don't know what is this, from lack of oxygen. Blood in cough also, I don't know what you have written this one. Okay, so but that's not the way you are going to write. Okay, you have to write that hypoxia is a better word to write it down. Okay, then next is on this date relevant. See, I told you again, whenever you are going to go to the next paragraph, you have to write the name. So you have to write James's relevant examinations were done which showed erythematous oropharynx. Now if you see this is the similar date that you are writing over here. Okay, why would you write date twice? It's a single paragraph. Okay, it's a single date on. So do you think that you will take all the history? Okay, then you will do all your work. Okay, and you will come back again and then go for the examination. Does that happen in anywhere, in any hospital? It doesn't make sense. You just have to be very active while you're writing. Okay, so you're writing the similar date but you're made to different visits. Okay, These sort of mistakes are never going to be relieved, okay, and they will not forgive you for this, okay. Relevant examinations were done which showed erythematous oropharynx along with increased breath rate up to 30 breaths per minute. This I should be smaller, R should be smaller, B should be smaller, and decreased saturation. Also indicates sonorous wheeze. So sonorous wheeze is something which are going to be indicated by the low saturation. It means someone who has 100%, like 96% saturation, he can't have any wheeze, okay, and someone who has 80%, he can't have except sonorous wheeze. He can either have, he can also have crackles, right? There could be some bronchi as well, there could be labor breathing as well, right? So this is not indicative that because the saturation is low, that's why it is indicative of sonorous wheeze. So that's not at all very good. Sound of base of lung. See, the whom you are referring is a department, is a thoracic surgeon, okay. You are writing a letter to thoracic surgeon. So do you think he needs further explanation? And he's a cardiothoracic surgeon, is a consultant, is going to have some surgery on the patient. Do you think he needs further explanation of the crackles? Do you think you need to give the definition of crackles to the person who is thoracic surgeon, who is going to have surgery of lungs, and that is double lung transplant for the patient? So you are giving explanation in the bracket to that person that let me tell you what crackles are, you don't know. No, please don't do that. This is very, very common sense. You have to use it over here, okay. So that's why I'm saying like you have making the similar mistakes, and we have to improve. That's why I didn't send you the letter the other way, okay. So now you can listen and watch this video 3-4 times to improve your mistakes. This irrelevant, again, right name please. Investigations were ordered that showed pleural effusion and pneumonia in the chest x-ray, and also in CT scan showed chronic sinusitis. See, don't use brackets unnecessarily, please. Took tablet Panadol rapid. No, please. These are the medications. Now if you see what you're writing, this is the date and this is the date, the similar date, and the previous page as well. These all are the 3 similar dates. So I mean, you yourself think that this is 2nd Feb, this is 3rd Feb, and this is 2nd Feb. Now you are writing 2nd Feb history, this one. You are also writing the 2nd Feb history over here. This one is also for the 2nd Feb. And then again you are writing 2nd Feb over history over here. Then it means the patient told you some history on this date, then next day he told you this one, and then the next day should be 4 if I'm not wrong, right? But you went back to 02. That makes sense. See, these are not mistakes, these are blunders, okay. You have to avoid. This is this is simple common sense, okay, and that you just have to be very active while you're writing, okay. And these medications that he's taking, this is history. This is the past medication that he's been on for cystic fibrosis. Okay, again see, again you're writing the same thing again, and then now it's a third. So, honestly, this is not, this is not letter. You are just writing few paragraphs, okay, like in which you think, or you have thought that you have to write history in a separate paragraph, and then you have to write like the treatment in the separate paragraph. No, please don't do that. I've been keep on mentioning this, that you have to start the date, okay, the name of the patient, then the symptoms, okay,